As a child, I was always involved in natural health. My grandmother, she would make remedies or make various teas and things like that when we'd have a cough or a cold. Even my physician, my medical doctor, he would make house calls and he'd just as soon give you a castor oil pack than give you an antibiotic. He didn't push drugs. He looked at how the body would heal itself. And when my dad would come home from playing tennis or handball, he'd lay on the living room floor and have me walk on his back and work on some of his muscles to try to relax him, starting at probably about age 9 or 10. So my whole life I've been involved in some form of health care about how helping the body heal itself, not so much as take an aspirin or take a drug or, well, why does the body, what can the body do normally and naturally to correct itself? When a body gets out of balance, when we have deficiencies of things, uh, that's when you have symptoms. And symptoms are just signs of something needs to be corrected. Something is missing in your life, just like when your car overheats or you have to add water. If you run out of oil, it's going to cause problems. If your car gets out of alignment, same way. It's going to give you symptoms and complaints. It's not going to function normally. So I'm a practical person. I'm a health gardener. I'm like a doctor who looks at how do we get the body to do what it's supposed to do normally and naturally. And throughout my life, that's been the focus of what I do. I see many very complicated cases. I get referrals from all over the country, from all walks of life, all different conditions when people have been unsuccessful in finding the solution. Um, I got a patient 2 years ago from Portland, Oregon. She came in and her complaint was every morning when she got up, blood would pour out of her colon. Then for the rest of the day, 8 to 10 times, she'd have a little bloody diarrhea, and she had been to hospitals, been to doctors, specialists, and nobody could figure it out. I put her on about 15 supplements, and within 4 days, the bleeding stopped. Within a week, she had normal bowel movements. So I didn't try to control the symptoms, which is what everyone else was trying to do. I looked at what was causing it, and we quickly found several causes, corrected them, and in no time at all, she was able to reduce what she took. And she came back a month and a half later for just a checkup. Everything's fine, and she's been fine ever since. So when the medical community looks at things, medical doctors are great to give you a drug or surgery. If your life is in danger, you must go that route. But when you're trying to get yourself well, it's more important to figure out what's missing. What are the missing pieces? Why would my body do this? Why would it let me get this sick? Or why get this run down or have these symptoms? So it's health to me is very simple, and I try to break it down so people can understand when they're having this symptom, what it means, what it's indicating. Everything is just clues telling you what something is out of balance. So the essence of what I do, simplicity. My goal is to get you out of my office as soon as I can. Initial visits are rather lengthy. They can be rather lengthy, and can be very detailed. But once we get the basic stuff set up and once you have a basic understanding, you're going to fix yourself. I never heal any diseases. I never treat any diseases. I'm a chiropractor. My focus is on balancing you out with very gentle work. I'm a non-force chiropractor, and the adjustments I do are very gentle if that's something that you need. And so getting to the root cause, that's my goal, to help you get well and to keep you out of my office. If I have to keep working on the same thing over and over again, then we need to figure out what's missing.